Welcome. My name is Jennifer Macklin. I'm an Ayurvedic practitioner in Chattanooga, Tennessee at chattanoogaayurveda.com. Today I have a special guest, Renuka Kulkarni, who is a Vaidya from India and a specialist in women's and men's infertility. So today we're going to talk about just that, infertility, how it is treated in India, and how what can be done in the United States with what is available here for Ayurvedic practitioners. Um, so we will also discuss how the practice of Ayurveda in India differs from the practice in the United States currently. We'll talk a little bit about the Ayurvedic body types and their tendencies towards fertilization and the limitations of this understanding. So we'll get into what the causes of infertility according to Ayurveda, and we'll also talk about successful treatment and what that looks like. And finally, we will talk about how to maintain good reproductive health. And there's really a lot of great substance that Ayurveda can provide for maintaining reproductive health. So I would like to introduce my guest, Vaidya Renuka Kulkarni. Um, Renuka is an Ayurvedic infertility specialist. She's located in Maharashtra. I hope I'm saying that correctly.
Yeah.
Good. Okay. And she's been a specialist in infertility for the past 29 years. So she has a lot of experience, and she also has been a guest lecturer and speaker in several platforms. Um, so it is wonderful to have her here today. Renuka,
Thank you.
thank you for being here.
Thank you. I'm also thankful to you to give this wonderful opportunity to share my experiences with all on this huge.
Yeah, yeah, it's great to have you here. I think the screen is frozen for a minute, but hopefully it will join back in. Um, so um, let's see. Okay. Vaidya, I just want to explain a
One
couple.
in.
There you are. Let me tell our audience first what a Vaidya is, because there are some people
Yeah,
that
yeah,
will be
okay,
watching this that are new
yeah,
to Ayurveda.
yes,
This term Vaidya refers to an Ayurvedic expert, essentially. It is somebody who has trained in the classical Ayurvedic texts and has
yes.
developed a expertise in them and ability to practice using the substances that come from the Ayurvedic texts. So a Vaidya, I'll put it in the chat so that everybody can see. It's Vaidya.
Yeah.
In the United States, we use this term because, for one reason, because Ayurveda is not licensed here in the
Yeah.
U.S. So,
Yes.
we don't want to confuse anybody by referring to the Vaidyas as a doctor.
Yes.
In the United States, they are not doctors, but
Yes.
in India, however, their training is equivalent to a medical school training.
Yeah, they are using as a synonyms that Vaidya and doctor are same. But when we are practicing as a classical Ayurveda, we like to pronounce ourselves as a Vaidya.
Hmm. Good.
Uh-huh.
Okay. Renuka, could you tell me how did you get into Ayurveda, and
Yeah,
what brought you to the study of Ayurveda?
there is a long story about it. When I was in 11th standard, I got fever, and it was a high fever, and it remained for 8 months, and every investigation was done from brain to the tips of the toes, but no problem at all. And everyone was saying that there is no problem, and this is PUO. The diagnosis was PUO, that was pyrexia of unknown origin. And no one knows how what to do. My parents were very anxious because they cannot find the answer. My grandma was there, and she was practicing Ayurveda. And as a beloved daughter-in-law, not daughter-in-law, uh, as a beloved child, granddaughter, I used to do some work with her. And she told me, "Oh, I will give you some medicine decoction, but it is very, very bitter, and you have to drink it. And then and then only we can try this." So I said, there was no option for me. So I said, "Yes, we can try." And it was a Kirata Tikta Kadha decoction, and I drank it. It was very bitter. And after that, when I was eating sugar. It was I was thinking that it is bitter only. But after 1 week only, I got uh, relieved from the fever, and which was up to 8 months, which was not at all coming down fever. But she due to this Ayurvedic treatment, it came down. And
Wow.
after that, that was cured completely. So I thought, I had taken admission to electronics. I was a bright student, and I was having admission in electronics. But I feel from the bottom of my heart that I should work in for Ayurveda more and more. So this is my story, because I was just cannot live without these medicines. I was with fever, and electronics is okay, but I should more and more study about the Ayurveda. So I took admission instead here. MBBS, that is allopathy practice, is more that at that time that was more renowned.
Mhm.
But I instead of taking admission there, I preferred to took the admission to Ayurveda. I studied Ayurveda thoroughly, and then got the results, and I enjoy my practice. This is
Yeah,
my passion.
yeah,
Yes.
that's wonderful. It's so many people, I think, have been touched by Ayurveda in some way, and then their interest really develops,
Yeah,
and
I
that was
feel that there is something which I should study, and there are some medicines that are hidden inside the granthas, and that I should know more and more.
yeah, yeah. I had the same experience. I was helped with Ayurvedic treatment, and
Oh,
I really found that what was given to me was so unusual that I would not have had the same treatment in from any place else. So
yes.
it really piqued my interest in Ayurveda.
Yeah, that was the story.
Yeah.
Yes.
So tell me, how many over the past 29 years, how
Yeah.
many women do you think have you treated, and what can you share with us about infertility?
Yeah. Uh, uh, More than I can say 15,000 patients I have treated successfully, and 5,000 couples are gifted by a baby boy or baby girl, infertile couples, which are having the problems like PCOD, low AMH, thyroid, obesity, repeated IUI, IVF failure cases. When these patients, Jennifer, visit to our clinic, they feel lost, they feel guilty, and they feel, many of the patients were suggested by, you should, oh, you will not conceive by your own egg, you should take donor egg. And they feel depressed. Oh, if I want to get pregnant by the donor egg, I will. Why should uh, I I will prefer to adopt the child. Why should I go for all these procedures? And after failure of these cases, when they got results, it is very beautiful for them. And I have invented my own technique of Uttar Basti, which we will in a further discussion we will speak about it more. But that method is more effective, equally effective, and less painful. And I have performed more than 60,000 Uttar Basti. And touch wood, there is no complication up till now, but it should be done with a expertise, with expert hands. The hands should be more and more expert.
Hmm. Yes, so I'm really interested in hearing more about this Uttarbasti.
Yes.
In my studies, I've heard of it, but don't know
Yes.
too much about it. It is a treatment that's not done in the United States.
Yeah.
So that is one thing I wanted to touch upon is
Yes. Sure.
how the practice of Ayurveda in the United States is different than what is being practiced in India.
Yes.
Part of that has to do with the educational system here. Um,
Yeah.
so there is in India a study of Ayurveda is a 5.5 year minimum
Yes. Yes.
study for the BAMS degree, and that is the
Yes.
Bachelor of Ayurvedic Medicine and Surgery.
Yes.
So that
Yes.
is the minimum for practice. Um, in India, I believe it is the Central Council for Indian Medicine that is the
Yes. Yes.
regulatory body. Okay,
Yes. Yes.
yeah,
And we are also having different ministry, Ayush ministry, AYUSH, that is Ayurveda, Yoga, Unani, Siddha, and Homeopathy.
yes,
Just
correct.
now, our government uh, decided to have this Ayush. Yes, this is Ayush. And this Ayush ministry is also governing just now for these Vaidyas.
Hmm. Yeah, so the education is very different. In the United
Yeah.
States,
Yeah.
um, Ayurveda is quite watered down and is sort of falling into a new age category where
Yes.
treatment of disease is not really tackled with Ayurveda in the United States. That is
Oh,
beginning to change a little bit. I
yes.
think there are some qualified teachers here that have been trained in India
Mhm.
that are teaching students how to manage disease with Ayurvedic medicine.
Mhm.
However, the majority of the schooling and the educational system is still based in a simple diet and lifestyle approach.
Yes.
But
Yes.
one thing, one of my purposes and reasons for having you here, Renuka, is because I want to share with people that there's so much more to Ayurveda that
Yes.
we don't we don't have that understanding here in the US. The media
You are
has.
doing a very beautiful job for Ayurveda.
Oh, thank you. It's I see the potential, and I
Yes.
there's there's so much collaboration that could happen.
Yes.
There's so much help that people could receive from it.
Yes.
Um, So, just a couple of the misconceptions about Ayurveda here in the United States is, people are thinking that it's vegetarian, that you
Uh-huh.
have to be a vegetarian. That's not true. You can be a meat
No. No.
eater. Meat is
Yes.
actually used for some
Yes.
treatments. Uh,
Yes.
People think also that it's related to spirituality,
Uh-huh.
where in reality you can be of any denomination, you can be of any religious affiliation and benefit from Ayurveda. You don't have to be a certain um, following certain beliefs or a certain spirituality. Um, and then also, people think that it's spa medicine here, that that some of these treatments have been taken into the spa
Yeah.
industry, but
Yeah.
it's not.
It's
It's
not
really
like that.
a medical system.
Yes. In India, Jennifer, in India also there are some misconceptions about Ayurveda. Many people think that there are no side effects about the Ayurvedic medicines. But when they are not used in a proper way, although they are herbal medicines, I will like to share one case with you. I
Mm.
was having about 25 years ago, there was a small child, 8 years old, and she got menses in the early age. And nowadays, you must have noticed that menses are, menarche is the age of menarche is becoming earlier.
Mhm.
And when she visited with her mother, she was a very innocent child. And before coming to Ayurveda, she went to allopath and they gave OC pills. I was shocked at that time because 3 months OC pills she was given. And then her mother thought that it is not good for her to give the OC pills. So
Are
she
these pills? Ththese are.
OC pills, that is oral contraceptive pills that
Oh,
will
okay.
regularize her. Yeah. So very, very thank you for correcting me for the abbreviations.
It's okay.
That is oral contraceptives and that will regularize her cycle. And then she felt that, oh, I should not give the hormonal treatment. So she asked that doctor that, will you please give Ayurvedic medicines? She thought that, oh, I can give my Ayurvedic medicines, and she prescribed her aloes compound and Kumari also. As a result, the when the menses were about 21 days, they started coming after 12 days. And she actually, her mother was crying because she cannot understand how to advise her to take the pad and how to manage all the things. And this was due to the aloes compound. You must be knowing that due to kumari, the menses started coming earlier and earlier. So it is not, and many people like to read from different stories, and they like to practice it on their own body like a guinea pig.
Hmm.
So it is not good. They should take actual advice of a vaidya. They should know their constitution, then their dosha condition, and then they should, even they want to use any sesame seeds or any type of home remedies also, they should take advice of a vaidya, and then they should try it at home.
Yeah.
Again, there is a second misconception that ayurveda will give delayed results. Many cases I have treated, they are of infertility, got result from 1 month to 6 months. It is not like that they are delayed. We can give instant results, but we should know the actual samprapti, dosha dushya sammurchana, and then we can give the instant results also.
Hmm.
But we should know what exactly her body is suffering from. Then we can give instant results. Then
Hmm.
again, third misconception is we cannot use Ayurveda in emergency cases. It is not true. Due to this pandemic, both my husband, Dr. Mahesh, and my Dr. Varun, and both of them are working in COVID patients, and they found that in emergency treatments, when oxygen level was actually dropping, they were giving medicines and they are getting results. Oxygen levels were increased, and when the patients are associated with ayurvedic treatment, I will not claim that only with the help of ayurveda. When both treatments work hand in hand, many patients got excellent results, and post covid recovery is also good with the help of ayurveda.
Yes,
Because
I'm
I
sure.
think, Jennifer, this virus is not derived for ayurvedic medicine, so it is giving excellent results to ayurvedic treatments also.
Hmm.
So there are misconceptions.
Yeah, thank you for sharing those. I hear the same things here in the US, that there's no
Yeah.
side effects, that the
Yes.
results will be delayed, that
Yeah.
emergencies cannot be handled with Ayurveda. But
Yeah.
you're right, all of these are not true.
Yeah.
Mm. So, you brought up the body types a little bit and the doshas.
Yes.
Could you talk about the body types and how and if and how they contribute to infertility?
Yes. There are three body types major. Ayurveda thinks Vata, Pitta, and Kapha. These are the three types of body constitutions. According to Ayurveda Grantha, this constitution is decided at the time of Shukra Shonita Sanyoga. That is, yes, Vata, Pitta, and Kapha. These are the three constitutions, and this constitution is decided when Shukra and Shanu, that is when semen and follicle are becoming zygote. At that time, that may be in a summer or in winter or in rainy season. That time, this decides the constitution of that person, and after that constitution is decided, after that due to dushyam desham balam kalam analam prakritim vayaha, there different types of we cannot after the child takes different kind of diet, different regimen is followed. He lives at different places. Someone will live in America, in California, in someone live in coastal area, someone will live in the desert area, and that will decide because it when it is in the desert area, it will increase always increase vata. When it is nearer to the coastal area, it will increase kapha.
Hmm.
So this will dushyam desham balam. Then yes, the child is kapha, fertile age is pitta, and then the old age is vata. These are the conditions. Then Also, in the daytime also, the first, yes, there is a biological clock. So we have to follow that biological clock. So in Ayurveda, it is said that you should wake up early in the morning. Why? Because early in the morning, there was vata is more prominent, and it will help to eliminate all, excrete all the mala. That if you are having some constipation problem, excretion of this mala, that faces stools,
Mhm.
it will help for passing the stools. Then after that, there is pitta comes, pitta time at the time of 10 o'clock. At that time, you can eat your food that will be easily digested. So it is not like that only constitution is important for the fertility. Fertile age, with the help of fertile, she is having, according to Ayurveda, fertile age of the woman starts at the age of 16,
Mhm.
and then slowly it at the age of 50 she stops fertility. So this is fertile age, and it is more related to pitta. This age is related to pitta. So it is not so, we cannot correlate this constitution with the fertility. It will not affect the fertility of the patient, any constitution.
Mhm.
Oh, but yeah, if after 450 she want to conceive, that she will be in a vata state, and it will be difficult to get conceived.
Mhm. Okay. So the conception is the time when we receive our constitution.
Yes,
The
yes,
constitution
at
is
the type of
created.
conception.
Mhm.
Yes,
Yes, and then you're saying the desha,
yes,
the environments that we are
yes,
brought up in has a
yes,
huge impact on
yes,
how our bodies develop. Is that correct?
yes, yes, perfect.
Good. Yeah. Is the constitution that we are born with, does that lend anything to our chances for fertility?
No, but when we are facing the patients with low AMH, I will like to share one thing, that many patients are, due to infertility, they are coming to us with low AMH, that is anti-Mullerian hormone. Anti-Mullerian hormone is the, when she is taking birth from her mother's womb, the actual um, number of follicles are decided. Suppose she is having some number of follicles, and after doing repeated ovulation monitoring and ovulation induction, they took actually reproduce more and more fertile eggs and take away from it. And after that, when this low AMH is there, otherwise there are premature ovarian failure patients are also there. These actual Mullerian follicles are decreased in size, and at that time the chances of fertility are very low. So due to these hormones, the fertility chances gets reduced. But at this time, with the help of Ayurveda, we can focus on quality of the eggs, quality of the seeds, and these follicles, and that will help us to conceive that patient.
Mhm.
Instead of focusing on quantity, oh, your numbers are very less, they used to afraid the patient that your number are very less, you should try it for IVF, you should go for ICSI, that is intracytoplasmic injection, or assisted reproductive health, reproductive procedures, and they are all costly. But due to all these treatments only, they got this low AMH problem.
Mhm. So are these are the Shukrala group of
Hmm.
substances, correct?
Yes.
Yes. And so in these substances we have things like milk, right?
Yeah, yeah.
Milk and uh, butter, right?
No, pardon me,
No.
please.
Butter. Um,
Please, I cannot understand your point.
oh, okay. So
Yeah,
I'm wondering, how is it possible to increase the quality of the
yeah. After doing complete detoxification of the body, we can increase, because Shukra, you all know, uh, is the last dhatu. And when we start from Rasa dhatu, Shukra dhatu obviously it is having the good quality, and after that we can give the results to the
Okay.
patient.
Okay. So the cleansing needs to happen first. Detox.
Yes,
Yes.
yes,
Okay.
detoxification should be done in these patients.
Um, we know another thing I wanted to ask you is, in your experience,
Hmm.
what are you seeing as as the underlying causes of infertility?
Yes, I will like to share some slides.
Please go ahead. While you're getting your slides ready, I'll share a little bit
Yeah,
with the audience about the detoxification process. So this is called
yes,
panchakarma. In the United States,
yes.
there's often a panchakarma is shown is given as a very simple regimen of Abhyanga or Ayurvedic massage, Shirodhara, and Basti or Ayurvedic medical enema. And this is common throughout the U.S. as panchakarma, but panchakarma is actually so much more than these three treatments. So,
व्हिडिओ कॉल चालू तू ये
uh,
2 मिनिटं फक्त शेअरिंग करे नंतर.
uh, so
Hello,
are you?
Jennifer.
Yes.
Please disable. It is disabled, so I cannot
Oh,
share my
oh,
screen.
okay, okay. I apologize. Okay, let's see how I can fix
Oh, no,
that.
no problem.
Okay. Hmm. Okay, should be okay for you. Can you try it again?
Yeah, yeah. Now it's okay.
Great,
Yes.
great.
No, no, it's okay. Uh, these are the causes. Huh. These, according to Ayurveda, causes. Ayurveda thinks on 3 levels: physical, psychological, and karmic. The physical level, on the physical level, we can do many things. It will be a different story because it will be, we will have to go in a deep, but we have to think about her nadi, mutra. And there are many psychological factors also. It is described in Charaka Sanhita, Sharirsthan, and Manasobhitapat. Here it is described that many psychological factors are also affecting the infertility. They also say that when they are having the repeated IUI or IVF failure, they feel that it is due to stress. So there are many patients who got conceived after only due to after Shirodhara, proper counseling, and listening yoga nidra only. They got the results. Psychological factor is more important because it affects rasadhatu also, parinaman of rasadhatu also. You must be knowing, all of you must be knowing that if we are eating something and if we have some phone or some bad news, we cannot eat further more food, and it directly affects our agni, and so the parinaman of the rasa is affected, and this is the psychological factor which is affecting more and more. Then the karma, many patients I saw that they are having some occupational problems. Some patients are having one of the patient I met, she was working on she was doing her PhD on uranium, and after exposing herself when she was pregnant, she was having the hydatiform mole. She developed it, and after that she had to abort it. Then when she visited our clinic, I told her that you should get away from that uranium, get pregnant, continue the pregnancy, and after that you can again go back to your work. Now her son is 29 years old, so it is the karma. Her sometimes it is occupational. There was one milk, he was um, giving milk to each and every home, but he closed his milk station, and then he started giving the beer bar. He started beer bar, alcohol. And it is the karma, and he was suffering from primary infertility, and after doing many and many IUI and IVF, but he cannot get conceived. So I asked him, are you going to change your karma? He said, no madam, it is very late now. So I said, no, I cannot give you treatment because it is your karma and you are suffering from it. So when you are giving some amrut in each and every home, you are started giving toxins and visha, and it is your karma. Some one patient I met some 20 years ago, and they were feeling very guilty. That couple was feeling very guilty because due to repeated IUI and IVF, they were doing repeatedly MCREDIL, MTP, medical termination of the pregnancy. She was having a baby girl and 5 or 6 years old, and after that she was doing MTP, and now it is the condition that she cannot conceive only, and they were feeling guilty for that. She belongs to a very rich family, and his mother was after him that you should get married for the second marriage. You should arrange for the second marriage because we should need some follower, uh, some inherited property. It should be carried for the further. So they were insisting, but by God's grace and Ayurveda is great, I treated that patient and they got a baby boy, and the family was relieved. Sometimes Ayurveda gives more intervention in that families, and many times it's the karma, very creates the problem.
The
Then
environment
in
that you're
physical,
in.
garbha sambhava samak.
Go ahead. I'm
Yes,
sorry. Go
yes.
ahead. Please
Garbha
continue.
sambhava samak. No problem. Uh, in physical, there are many factors. There is a shloka, Rutukshetra Ambu Bija. Then here, this shloka in Sushrutacharya Sharirstan, he actually gives the classical example of a farmer. What a farmer does if he want to sow a seed, he first cleans all the debris from the soil, remove all the debris from the soil, cleans the soil, that is Prithvi, that is earth Mahabhut, then pours water, that is Jala Mahabhuta, Jala, water Mahabhuta, water primordial element. Then he actually prepares mud. Then he selects a proper good seed, Bija Sanskar, Bij, that is seed, embed it in the mud and allows the sunlight to fall on it. That is Teja primordial element. Then this Teja is very, very important for this conversion. So due to this Teja primordial element, multiplication of the cells occurs. Vayu vibhajati. So this Vayu, that is air primordial element, it gives the multiplication of the cells. It causes multiplication of the place of these cells in a huge form, and after that Akash, ether element, gives space for sprouting. And this is the method, exactly this method happens in the while formation of the fetus. And when we consider about this, all these things, we have to consider about the different factors. When I met with the abroad patients, more consultations online, they actually feel that no one is wondering about their constitution. They don't want to speak a single word. They just focus on the reports of the patient. But Ayurveda science is more and more focused on the, it is more personalized and the treatment is customized. So we have to think about the different parikshan of this patient. We have to do the Ashtavidha parikshan. We have to pulse reading. We have to do the pulse reading. This is actual more and more personalized treatment. We think about her mental state, her physical condition, her physiological condition, what are the different previous treatments she had taken. Her body her body is bombarded with the help of hormones. If she is having previous history of previous illnesses, any operations, undergone any operations, if there are any IUD inserted, like yesterday we discussed about the marina, or is there any copper T inserted, any MT pills are taken, or any eye pills are taken, only eye pills or oral contraceptives are taken, then all these things we should know. And by considering all these things, we have to do actual PV per vaginal test, then stana breast examination should be done, then Raja Parikshan, that's how her menstrual flow is there. Yeah, it is more and more personalized. We are always, just now we are more personalized. We are having our own mobile, we are having our own account. Like that, we are having our own menstrual flow also. And it will decide, is it a Raja vitiated, menstrual flow is vitiated, or it is not. So it should be examined properly. We should ask the patient that is it having clots, or is it blackish, or it is having foul smelling. Are her menses are regular, are irregular, is how much the time you are having the menses, bleeding is there. So all these things gives us a clear picture of the case taking.
Hmm. So pariksha is the Sanskrit word for assessment or examination.
Yes, yes,
So
assessment.
what Vaidya Renuka is referring to are all the methods of assessment that are done in examining a woman who is uh, experiencing infertility. So all of these areas, the pulse, the raja or the menstrual flow, and all areas of assessment, the history, the menstrual history, surgical history, everything is taken into consideration, which makes Ayurveda so personalized. Her diet, her lifestyle, her daily routine, these are all things that are also taken into consideration when considering when looking at what does this woman need to to um, to increase her fertility. So
Yes.
please continue. We want to hear more.
Oh, thank you.
Yeah.
Oh, I thought I was speaking a lot, so I stopped.
No, no, no. This is the good stuff. This is the meat.
I will like to share one more slide,
Please.
which are the underlying causes of infertility. Yeah, this is these are the major problems. Just now I am feeling that these are the problems which causes infertility in women. It is the lifestyle disorders, because no one wants to wake up early. The lifestyle is and regimen is becoming more and more lethargic just now. Everyone is doing brain work more, so calories are um, uh, burnt, but they don't like to exercise more. Here in India, they are not aware about the exercise, and no exercise, so they get weight gain is there, and there are many problems. Then excessive use of hormones is the second cause I met when I am practicing all these things. Because in India, if there are any some rituals, they don't like menses to be there as they feel that there is obstruction. Then they will take some pills, and they will get it ahead of that date. Suppose it is on 5, she will adjust it to up to 10. She will do all the rituals, and then she will allow the body to menstruate. Then it is not good. Then many girls nowadays I met, from they are college going girls, and they feel they are not getting their menses by their own. They has to take, they decide, oh, just now we have finished our exams, then we should have some menses. After 6 months, 7 months, they to get some Primolute N or Letrose and or Deviary, and then for 5 days, one BD or once twice a week, twice a day, and then after they will wait for 2 or 3 days, and they will have the withdrawal bleeding. The actual biological clock is disturbed, and after that the actual monthly cycle is also disturbed. So all these are leading to the PCOD. Central obesity, heavy breast, hirsutism. They are having more hair on their upper lips, then on their chin, on their breast, and more acne, then baldiness on their scalp, and hoarseness of voice. They are having more aggression in their nature. Testosterone hormone, like men, they are increased. It is increased in their body. And these women, alternate patient is having the problem of PCOD nowadays. Then no exercise is a major reason, but exercise should be in a proper way. It should not be in a particular way of burning the calories. After diet, it should not be done. It should be done early in the morning when vata uh, is prominent. The exercise should be done, and it should be more up to yoga, because it will balance the hormones in her body. Sun salutations are more useful, pranayam is useful. Then nowadays, excessive stress, I think woman body is not designed for this excessive stress. But by God's grace, we have the opportunity to learn. We learned a lot, we took all this opportunity, and we are working a lot. But due to this excessive stress, because most of the women are having the feeling that, oh, I should do complete all these things like a superwoman. She has to do the work at home, she has to take care of her son, child, or she has to work on their job, and she has to work hard. There are especially when I met with the IT patient, they are stressed, very very stressed. And this stress, proper counseling, then this stress gives rise to the irregular menses, then infertility. So proper counseling, shirodhara, and yoga nidra, and some yoga, pranayam also relieves this excessive stress, and after that they get conceived. So we have to think, and surprisingly it is detailed, it is described in Sushrutacharya. It is the major, manasobhitapat is the major cause of delayed conception. It is not said that it is a cause of infertility, but conception is delayed due to this excessive stress. And nowadays you must be knowing that everyone is having under stress, because COVID situation is also there. It is aggravating the stress. Then no proper sleep is also a major problem. Then because many women like to scroll their mobile at night, watch Amazon video or something like that, to watch the TV late night. And when they start doing all these things, the sleep, they cannot sleep in a proper way. Then late marriages is also a problem, because at that age of 38 or 40, when they plan for the marriage, after marriage, after 1 or 2 years, they feel that they should go for the conception, and at the age of 42 or 43, the fertility is decreased. So late marriage is also one of the cause of causing the infertility. And not taking rest during the menses. It is described that there is a complete diet and regimen. Different diet and regimen is described in granthas, that what should Rajaswala Paricharya be there, that is menstruating woman, how should she behave, what should she eat, and it is detailed, it is given in granthas.
It's interesting that you mentioned that in India, women are trying to control their fertility, control their menstrual cycle
Yes,
with using rituals. We see
yes.
the very same thing here in the U.S. Women
Oh,
trying to control their menses with exercise, with diet. It's
oh,
and people, we just don't realize how important it is to have the menstrual cycle every month for
yes,
3 days and
yes,
to take rest during the menstrual cycle.
yes, yes.
Athletes in the United States will not get the proper rest during the menstrual cycle,
Oh,
which can really cause a lot of problems.
yes, yes. It
Um,
is causing the problem of PCOD more and more.
mhm, mhm. Wonderful.
Yes,
Could you tell us about the Uttarbasti treatment and
yes,
what
yes,
that involves?
yes. Uttar
How
Basti, yes, I
is,
can tell.
is it different than a daven, than a wash for
Yes,
the
yes.
yoni?
Dush, it is different from dush. It
Okay.
is very different. Let me search for the slide.
Okay.
Give me a minute.
Sure.
In short, we can see what is the lifestyle during the menses. These are the do's and don'ts uh, one should do during the, because she is having a wound in her uterus at that time, so she should take the rest, because whenever there is a wound we have to protect, she should not get infected to that wound. And when she is vranita, it is actually described in granthas, she is having wound, so her diet should be a light diet.
Mm-hmm.
Instead, she used to order some food from Alexa or from Zomato, Swiggy, and she eat a lot. She used to eat chocolates to raise her serotonin levels, but this should not be done at the time of menses.
Mm-hmm.
So,
It's important not to insert anything during menses. So
yes,
sex should be avoided during menses.
yes, yes, that's
Tampons,
important
it
point.
would be
Yes,
beneficial to avoid them because
yes,
the flow needs to go downwards and out.
yes, yes.
Not it should not be stopped in any way.
You are
Um,
pointing towards the important point. Yes, that's
mm,
correct. Very perfect.
mhm.
Now we will go for the Uttar Basti.
Yeah, there's so many wonderful. There's a lot of wonderful knowledge that Ayurveda has
Yes,
for the menstrual cycle.
yes, yes. And it is they are they studied all these things in a detailed manner.
Mhm.
This is you can see this picture of Uttar Basti, and Uttar Basti is we
I'm
directly insert. Yeah, this is
I
uterus.
I don't see the picture yet. I only
Oh, oh,
see
oh, oh.
the
Let me
lifestyle.
let.
Yeah.
I think yes. Thanks. Can you see the?
Yes. Yep.
Yes. Huh. This is the picture of uterus. These are the fallopian tubes. You can see here fallopian tubes. These are actual ovaries, and we insert a cannula directly up to the cervix. This is the picture of Travarta yoni. We can see, or we can say at it is the uterus. It is a cross section of uterus.
Mhm.
So to understand, I had taken this picture, and we are inserting this cannula in a up to the cervix external os, and then we by the with the help of syringe, all these are all this procedure is done with complete disinfectant procedure, like a operation procedure.
Mhm.
All the things with oil, everything is disinfected, and then the oil is inserted directly into the womb. It travels to the through the fallopian tubes and up to the ovaries. It increases the fertility, endometrium receptivity. So before IU and IVF, one can plan for Uttarbasti. So it will increase the endometrium receptivity also. If she is having some problem of PCOD, we can give the medicine that will dissolve the fibroids or the cyst over there. If there are some blockages, tubal blockages, for the tubal blockages, Uttarbasti is very, very, very effective. But it is my experience that if it is at the distal end, it is fundal end, it can be removed earlier. But if it is at the femoral end, that is distal end, it is difficult to remove, but it can be removed. When we are having some option, it is we can have do some tuboplasty or some operation, laparoscopic surgery, to remove that block. But when some wound heals, it gives some kind of healing adhesions. And so after operation also, this is all these lines are very micro. So when we do operation, within 1 or 2 months she can get conceived. But if the block, we want to remove the block permanently, there is the best option is Uttarbasti,
Mhm.
and it is done from the 5th day up to 9th day for the 5 days. Because On the fifth day, the cervical os is opened, so we can insert the cannula easily. But at the same time, this procedure should be done under expert hand. One should know how to do the PV, how to palpate all the things, and is it acutely anteverted or acutely retroverted. Otherwise, there can be complications. It can be fatal. So it should be done in a proper way and with proper sterilization. This is the beauty of Uttar Basti, and it is contraindicated in virgins. I don't prefer to do all these things because it will break the hymen. Then, when there is a prolapse, cervical prolapse is there, uterine prolapse is there, I don't do any type of infections if of vagina, maybe sexually transmitted diseases or any vaginitis or cervicitis. That is, she's having a lot of huge white discharge. At that time, we can advise her to do the douche, or you can perform yoni dhavan, that is a wash of this vagina. We can do.
Yeah. So, what? Let's see. I'm wondering. That women, I'm sure women that are interested in a holistic treatment for
Yes.
infertility would like to receive something like this. Where,
Yes, yes.
how do they find a qualified practitioner in India? What do you
Yeah.
recommend?
Yes. Holistic method, these points are there. Ayurvedic medicines, Panchakarma, Ahar, Vihar, and it is all personalized because up to by your constitution, where you live, what are your body habits, and considering all these things, one has to take, we have to give the counseling that you should do all these kind of yoga, and this is the pathya, that is the, you should take all these things and you should avoid eating this, and this is the holistic method of uh, treating the infertile patients. Please pardon me for your question. Can you please repeat your
Yes,
question?
yes. So women that are interested in these treatments for infertility, how do they find a qualified Vaidya in India and to
Yes.
come and receive?
First of all, they should look authenticity. Are they BMS or MD? Are they studied in an authorized university? That means we are having here Maharashtra, Nashik University is there, Rogi University. So that she should they should think about the proper registration number and all these things. That is the legal point. Then her expertise, how many patients she had treated, that you can search about it. Then there are, in India we learn from Guru Shishya Parampara. So she is working under whose guidance. This Guru Shishya Parampara is more important in India. So all these things matter, and you should search actually to find the authentic practitioner. You should do some proper searching, online searching we can do, it is also available. And you can ask about the patients reviews also. Oh, are they satisfied with that practitioner? Because malpractices are also present in India, so we should know all these things.
I think it's important, even in the United States,
Yeah.
to ask for, where are these, who have you studied with? Who has the
Yes.
practitioner studied with? And this is the Guru Shishya Parampara model of
Yes.
learning Ayurveda, where you're studying with a teacher or a guru. Um,
Yes.
so that would be a great question if you're in the United States looking for a practitioner to ask of
Yes.
people, who have you
Yes.
studied with? Because it's important, the educational level, like we said earlier, in the United States
Yes.
is all over the place. There's not a lot of regulation of it yet.
Yes.
So it's important to find people that have trained with qualified individuals.
Yes. The only concern is they should not go in false hands, and they should not treat their body wrongly. That
Right.
is the concern.
hmm What else do you have to share with us, Renuka?
Pardon me.
What else do you have to share with us? I see this
Uh,
picture of a little baby.
yeah, she's a successful case I will like to share. And her mother is a housewife, and she was suffering from repeated abortions, habitual abortions.
Oh,
And her husband was MR, that is medical representative, and they visited to us. I told you that it is a common misconception that when she is not having the, actually they are feeling that woman body is a fertile machine. I don't like to say this, but in India, they look to woman body as a fertile machine. After 1 year of marriage, there are whispers that if when will you give the good news? Yes, she is also eager, but sometimes it doesn't happen. So as a woman, one should understand the pressure on her. The society is also having some more and bombarding her pressure on her. Same the same thing happened with her, and she was conceived immediately, but some fantasies are there. She want to they both of them want to enjoy their married life, so she first baby was aborted by taking empty pills. Second time she got conception, but there was no fetal heartbeats, so that was aborted, that was miscarriage. Third time she was again having the conception within 6 months, but that was also aborted, and there was at that time there was no fetal pole, no fetal cardiac activity also, and that was aborted. When they visited to clinic, she was feeling that because conception was not problem, but she was having habitual abortions, and the fetus development of the fetus was not so good. So they visited, and they, as a MR, he was knowing all these assisted reproductive health systems. He visited many doctors, but they told that, oh, she is having the abortion, so what should we do? So this is the beauty of Ayurveda, because we gave only bija sanskar treatment, that is a total detoxification. After taking her detailed his case history, it is again a common misconception that each and every uh, person should do all the five karmas. It is not like that. Only she the all the samprapti was avrodhatmak. Kapha vikruti was there. She was having repeated rhinitis, allergic rhinitis. So woman was plunged for bija shuddhi, and uttarbasti, one uttarbasti was given. That 5 days, one uttarbasti cycle was given, and in next month she was conceived. But conception was not problem. And then after 2 months, when sonography was done, everything was normal. She was relieved because she was having tremendous stress at that time. Oh, what she is going to do? This is also going to be aborted or not? But after, when she saw all the cardiac activity is well and all the things are good, they actually felt very good. And it is commonly practiced that she should be with hormones. No hormone was given. No hormone. Only thing we gave is masano masiki vruddhi and the Garbha Sanskar treatment. And you can see the results. She is very brilliant.
mm-hmm.
And each and every child, I gave treatment of Garbha Sanskar and Bija Sanskar, because Supraja is the aim of our clinic. That the next generation should be more and more healthy, having good resistance and good immunity. And in this pandemic situation, I studied the eldest one is the oldest one is 29 years old, and the youngest child is just 4 days uh, old. But
Wow.
none of them is having this corona infection. So importance of good immunity, with the help of this masano masiki bija sanskar garbha sanskar, good, we can focus on this good immunity, good IQ, intelligent quotient, good EQ, good emotional quotient, and the overall personality are very good, and they are grasping more and more things. Some hereditary problems are there in their hereditary. They can be removed with the help of this bija sanskar and garbha sanskar treatment, and we can go further, proceed further. And this gives more and more satisfaction to me.
Yeah, I bet it does.
Yes.
Yeah. Um, in the U.S., a lot of there's a lot of wonderful information about this Masanu Masaka, this month by month regimen for
Yes.
the pregnant woman.
Yes.
There's so much wonderful substance there that Ayurveda can provide for women who
Yes.
are pregnant. And in that
Yes.
first trimester, that is really the time when a woman should be getting the rest, um, uh,
Yes.
more so than the last trimester. I think we've got it opposite here in the United States. You want to make sure that
Yeah.
that baby takes hold during that first trimester. So that is the time
Yes.
to get proper rest. And
Yes.
yeah.
After fourth month, I used to give the medicines because I'm saying that they are having good intelligent quotient, because I give medicines for development of the brain. And actually I uh, teach the patient, my clients, to how to speak with the baby, because after fifth month they start growing their ear, and they can listen. And then I because after talking to each other, because you can see two animals are standing in front of them, each other, they don't speak to each other. So the brain is not so developed. But after speaking, human being is having developed brain due to speaking. It may be in any language, your own language, but mother should talk to baby. Whenever she started talking, this samvad, we call it in our language, samvad, conversation, is very very important for the development of the brain.
Mm.
So music therapy is also very helpful. Yoga nidra is helpful, and for the normal delivery, different kind of visualization is very helpful. And all this process can be done enjoyable. So these patients never feel any problem with the help within their pregnancy. This is enjoy. This can become enjoyable journey. Many female I've met, they feel that they will lose their form. Then I have to give them examples of our famous actresses. They had not after giving birth also they had not lost their form,
Hmm.
so they can feel that, oh yeah, we can plan for a baby.
Hmm.
There are many cases and many examples. I cannot stop myself.
Yeah, I'm sure. Um, we have one a few comments from our audience member,
Okay.
Suzanne. She's saying that it is so joyful, and I can tell you love your work. It
Oh,
is so clear that you're so
thank you,
happy
thank you.
and
Yes.
fulfilled with this. It's wonderful. Um, there is also a question about endometriosis. Suzanne is wondering if there are Ayurvedic treatments for endometriosis.
Endometriosis. Yes, I have treated endometriosis up to fourth grade. Endometriosis is Vata Vikruti. It is Vata Vikruti because it is leaving its sthana, its ashay, uterus, and going outside the uterus. Outside the uterus up to the ovaries also. And I met one patient, she was MD Gynec only. Roaring, she was having her roaring practice in Pandharpur, that is rural area, and she had developed a chocolate cyst with that, and she has to aspirate it every time by going to Solapur. Then we gave Basti because it is a Vatavikruti. At first, I don't give Uttar Basti to her. Only Basti. That is earlier that I advise her to do Snehan Svedan and Basti, Anuvasan Basti. After meal, I was giving her 60 ml of Anuvasan Basti,
Mhm.
and that helped her. That first she stopped the aspirating that chocolate cyst. Every month she has to travel for that aspiration of chocolate cyst. Then the endometriosis was cured, and then she got twins.
Oh, wonderful.
Yeah, that we can get the results.
Yeah. So this basti that you're referring to, this is essentially it is a an enema that has a
Yes, yes,
formulation usually with it, some
yes.
type of medicinal formulation in the enema,
Medicinal
and
formulations. Yeah.
oil as well. And the vata dosha is
Yes, it is the
when.
shlok in Grantha that nahi vata drute yoni. So any yoni vyapad or 20 types of woman yoni diseases or vaginal diseases are described, and each and every yoni vyapad is a cause of infertility. So different kind of diseases, vaginal diseases are important, and they are all causes of yoni vapat,
Mhm.
infertility. So most of the times this basti will help, but we should know, understand by that slide, we should know her constitution, what are the exact problems, and then we can advise her
Mhm.
according to her constitution.
Wonderful. Is there anything else that you would like to share with us before we close?
uh, Not so. This is one my mobile number,
Okay.
and
Wonderful.
you can take, if anyone wants, they can take
Okay.
the screenshot.
Great. And your Gmail address is here too. And
Yeah,
for anybody in the United States, it's easy to contact somebody in India using WhatsApp. Is that
yeah,
correct? We can reach you on WhatsApp?
yeah,
Yeah.
no
Okay.
problem. Yeah, it's
Okay.
correct. Yes.
Great. And yeah, if there are questions, please reach out to either of us. We'd be happy to answer them for you. Um, yeah, it's been wonderful. I feel like we could talk for another few hours about these topics.
Yes. I also feel that we
Yeah,
can talk more and more about all these things.
yeah, yeah. It would be wonderful perhaps we can do this again at some time.
Yeah, and it's wonderful to speak with you, and you are a good practitioner. And
Thank
I
you.
pray to Lord Dhanvantari that you should become a good practitioner, good Vaidya.
Thank you so much. Thank you.
Thank
Oh,
you.
it's wonderful to have you here. Enjoy the rest of your evening, and if please reach out to us with questions. We'd be happy to answer them.
Yes,
Okay.
yes. After that, also, if there are any questions, you can ask.
Thank you.
Thank
Okay.
you.
Good night,
Okay.
everybody.
Good night.